Yeah, for sure. Let's go back on multivitamin quickly. Tell us about USRDA minimum requirements and what you actually recommend.
Oh, that's a great point. I usually recommend significantly more than the RDA levels, especially if you, I was hoping, I think most people are surprised. So if you have your supplement bottle, you have the nutrition facts panel on it, and you see something that says like 2,000% of the daily value or 3,000 or whatever it is, those can be intimidating if you don't know better. It's like, oh my gosh, is this toxic at these levels? I don't think most people realize is that the daily values were based off the 1968 RDAs. So in terms of that, it hasn't changed in the past, 55 years in terms of what that percentage is based on. So although the RDAs have changed since that original time period, the actual daily value that those numbers are based on has not been updated.
Yeah, and those numbers, if you look back into it, we could have a whole podcast on that. But when those numbers were originally made up, the USRDA originally made up post World War II, it was on how much of a nutrient it took to prevent a disease, i.e. scurvy. So the USRDA of vitamin C is 60 milligrams. And what they would do is they would deplete people of post-war veterans, World War II veterans. They would deplete them in vitamin C till they got scurvy, and then they would replete them with a certain amount until 50% of their scurvy symptoms went away, and that was the USRDA, 60 milligrams. Well, I don't know about you, but I won't want a chance of 50% of myself getting scurvy. So, the numbers are way, way conservative and way low, and they're also based on when our foods were grown in different environments, that the mineral content and the vitamin content of our soil was different. So
no, and that's those are key points that I think can easily get missed. Our food supply isn't what it used to be back then.